So part of this is a good history. It's very important to get a good history. A good history includes the age. Each kind of patient has different indications and contraindications. A lot of times a younger patient you can use some modalities on, but you can't use some of the same modalities you'd use on an older patient. And some of the older patients, you don't want to use some of the modalities you're going to use on a younger patient. So age is an important thing. Their chief complaint, or what are they in there for? Are they in there for knee pain, back pain? Their mechanisms of injury. That's what MOI stands for, mechanism of injury. How did they hurt themselves? A lot of times, especially like in the athletic population, if you're at practice, you'll see how it happened, or someone will say, hey, I was playing pickup basketball in my church league and I rolled my ankle. So that's your mechanism of injury, is an inversion sprain. The date of injury is very important. That gives you a lot of clues of what you're going to be using. Someone comes into your clinic and they say, hey, I've been dealing with knee pain and it started off kind of just a nuisance a few months ago and it's just gotten worse and worse and worse and now I can barely walk. That kind of tells me I got a pretty bad tendonitis probably. If they come in, again, I was playing pickup basketball in my church league, stepped on someone's ankle and rolled it, felt a pop, and now it's really swollen, and this was yesterday, then that tells me it's probably more of an acute injury. Onset, same thing. The type of pain. Pain will really tell you a lot about what's going on. Dull, kind of achy pain is more of usually associated with chronic injuries like tendonitis, while a sharp, burning pain is more of an acute, like a torn ACL. And the location of the pain that can tell you about the tissue. Almost all the time I've had someone blow out their ACL, they always feel that burning, sharp pain in the back of their knee. And if you kind of look at a model of a knee, that's where that ACL is more towards the back. The types of pain we talked about. What helps? Getting up in the morning just kills me, but taking a hot shower really makes it feel better, and I can move better. Those type of things. Doctor evaluation. What did the doctor say? Is he sending this patient to your clinic for treatment for a tendonitis? That's big. What makes it worse? Sitting down in class and then having to get up really kills it. Anything make it better? Taking a leave or ibuprofen makes it better. Past medical history. Have they ran a marathon? Were they treated for something else? Maybe they sprained an ankle on the opposite foot. That could give you an indication. Past treatments. I've tried ultrasound and nothing, and that just hasn't helped. I mean, you got to put yourself in a patient's position. If they're coming to your clinic kind of frustrated looking for answers, and you're always starting at square one, well, let's put a heat pack, and they've been to 4 clinics where they put a heat pack on and nothing's helped. You need to know that, because that's obviously not helping, so skip through that. Surgeries, current medications, allergies are all important things to get. Believe it or not, people are actually allergic to ice. Indications and contraindications. As we're going to be talking about modalities, we'll always have indications and contraindications. Indications are things that you would use this modality for, and contraindications are things you cannot use, that you can't use the modality. So an example of a contraindication is you don't want to do ultrasound on someone with metal implants, because the ultrasound will heat up those implants, those metal implants. Your date of injury is going to be a big thing. Whether you use heat or ice really is going to depend on, is it a fresh injury or more chronic? The age of the patient. Use ultrasound or e-stim on a young prepubescent teenager or child. You could actually stimulate the growth plates to grow early and close early, and that's not a good thing. Like I said, people are actually allergic to cold. They'll break out in hives. You need to know that before you put an ice bag on someone. Neurological deficits, if they can't feel as good or they don't have good circulation, you don't want to put up something where like an ice pack or a heat pack where they might not be able to tell if it's too cold or too hot. pain. What type of pain are they having? Is it real mild pain like muscle soreness? Are they getting back into shape, or is this an athlete getting back into shape, or is this someone who had a complete knee replacement, and they're just in so much pain that you really need to kind of control that pain? Location of the pain. Are they having pain in their leg? Is that from a lumbar issue in the back, or is this just from a strained hamstring? Type of pain. Again, remember what I said. Acute pain is usually sharp, burning type pains, while chronic pain is more like a dull, achy type. The treatment history. Things that have worked, haven't worked. Surgeries. Metal implants. Again, that's a major contraindication for a lot of things. Medications, some people are, maybe the doctor has prescribed a steroid, so you got to be careful on what kind of topical treatment. Some of these creams we use for ultrasound have a little bit of non-steroidal medicine in them, so you need to be aware of that. Pregnancy obviously is a big one. Cardiac conditions, if you're working in a clinic, you have a 65-year-old man with history of heart disease, you may not want to throw them in a 105-degree pool and risk them possibly having a stroke or cardiac arrest. Types of skin lesions. You're rubbing, you're using an e-stim pad on someone with some kind of skin lesion. Make sure you throw it away or clean it up before you use it on the next person. Tumors, any kind of heat modality, or a lot of our modalities will actually increase tumors. So someone with cancerous tumors, you've got to be careful in what you use. And infections, the same thing. And of course, circulation problems. And some general modality safety. Check the machine, make sure it's in proper working order. All machines have to be calibrated and checked yearly, so you need to make sure the machine's working properly. Position of the patient. This is very important. You want them to be comfortable, but you want you to be comfortable, especially if you're doing something like a HIVAMAT where it's a 20-minute treatment. You want to make sure they're in a position where you're comfortable and you can finish the treatment. You always want to expose the area to be treated, but respect the patient's modesty. I worked a lot of track when I was at UTEP, and we had a lot of runners from Europe that really had no problem stripping down right in the middle of the training room for treatment on the real high on their hamstring. And so you just got to make sure you maintain a professional modesty and drape your patients accordingly. And also, don't be afraid to explain your rationale for your treatment and how a machine works before treatment. This will really help them sort of buy into the treatment, and it makes you look good, makes people have trust in you, and that you know what you're doing. And that's all I have. Thank you. See you in class.